So guys, I just wanted to show you what a product monograph looks like. According to Health Canada, a product monograph is a factual scientific document on a drug product that describes the properties and conditions for using the drug and the information required for optimal, safe, and effective use of that drug. So the product monograph consists of 3 sections. Part 1, which is the health professional information. Part 2 is the scientific information. That's where you'll see some of the results from the clinical trials and things like that. And Part 3 would be the consumer information or patient medication information. So all product monographs follow this template. So in Part 1, which is the health professional information, this is where we would find the warnings and precautions section. There's also a warnings and precautions section in the consumer information, and the bill is proposing that both these sections be disclosed with the healthcare provider and the patient. Now, according to Health Canada, not all drugs have a product monograph, but most prescription drugs and some non-prescription drugs will have this monograph. So we're just going to take a look at Abilify, which is also known as aripiprazole if you go for the generic. Abilify is an antipsychotic. This particular monograph is for the injectable form. So here we can see in Part 1, the health professional information. There's the summary product information, indications and clinical use, contraindications, and right under that, you'll see the warnings and precautions, which is the section the bill is proposing that doctors go through with the patient. So we're going to go down to page 4, where we see our warnings and precautions section. And here the first thing we see is what's called a black box warning. Now, black box warnings are required by the U.S. Food and Drug Administration for medications that carry serious safety risks. So here we see for Abilify that elderly patients with dementia treated with atypical antipsychotic drugs are at an increased risk of death compared to placebo. Now, even though we can see that this is information intended for the health professional, you can understand why it's also important for the patient and the caregiver to know this as well. And the language is plain enough for the layperson to understand, even if they need a little help from their healthcare provider. We'll get to Part 3, which is the consumer information section, but I just want to show why it's so important that both the consumer and the healthcare provider know this information. So this is further divided into sections. We have cardiovascular. It says aripiprazole may induce orthostatic hypotension, tachycardia, dizziness, and sometimes syncope, especially at the initiation of treatment. Now, the doctor can explain to the patient what tachycardia and syncope is, but again, the language is fairly plain. Now, some of it gets a bit technical, but we can see the main points are very important. It says aripiprazole should be used with caution in patients with known cardiovascular disease. I don't know about you, but I'd like to know that before I agree to take Abilify. Now we have a section called endocrine and metabolism, and it says diabetic ketoacidosis has occurred in patients treated with antipsychotics with no reported history of hyperglycemia. If you're not sure what ketoacidosis is, when the body uses fat for fuel, it creates a type of acid called ketones. And this is safe as long as the levels of this acid are low. But if the acid builds up, that's what's known as ketoacidosis. And this is potentially fatal if it's not treated. Now, does this sound like information you'd like to know? Because I'd like to know. It's also saying aripiprazole can exacerbate pre-existing conditions of diabetes and hyperglycemia. This is life and death information right here. Can you imagine a doctor prescribing Abilify or aripiprazole to a patient and they have hyperglycemia or they have a history of hyperglycemia in their family? We also see, still under the endocrine and metabolism section, that this drug can also cause weight gain, and it says clinical monitoring of weight gain is recommended. I'm going to skip down to neurologic, and we see here it talks about neuroleptic malignant syndrome, which is rare, but as it says here, is potentially fatal. And we can see in the next paragraph what neuroleptic malignant syndrome looks like. It can cause hyperpyrexia, which is where you run a very high fever. There's muscle rigidity and altered mental status. Again, some of this language gets technical, but your doctor should be able to explain it. And if he can't understand it or she can't understand it, I'd say you're both in trouble. We have a section about falls. We see a section about tardive dyskinesia, which is a very common side effect associated with antipsychotics. And it says it is a syndrome of potentially irreversible involuntary dyskinetic movements which may develop. Now let's move down to the psychiatric section. And here is the precaution of suicide. Now it says the possibility of suicide attempt is inherent in psychotic illnesses and close supervision needs to accompany drug therapy. Now it doesn't say out and out that Abilify can cause someone to commit suicide, but other antipsychotics have also warned that they can cause suicidal ideation. Now it goes to special populations. And the first thing we see here is about pregnant women. It says there are no adequate and well-controlled studies of aripiprazole in pregnant women, and it is not known whether aripiprazole can cause fetal harm when administered to a pregnant woman or whether it can affect reproductive capacity. This is very important to know if you're pregnant and have concerns. It looks at persons who are younger than 18 years, then persons who are older than age 65. And finally, we have a whole section looking at the use in elderly patients with dementia, which has been a very controversial subject. The Toronto Star did a look at the use of antipsychotics in Ontario nursing homes after there were a series of deaths reported. So I'd say this is pretty important information. See here it talks about cerebrovascular adverse events, including stroke in elderly patients with dementia. Aripiprazole is not indicated for the treatment of patients with dementia. Do you think this is something a caregiver should know? Or persons who have an elderly parent in a nursing home should know? Okay, so that completes the warnings and precautions segment of our product Monograph for aripiprazole, or the injectable form of Abilify. As you can see, it's only a few pages long, 5 or 6 pages, but this could be the most pivotal information for a patient taking Abilify. Now let's scroll down to the consumer section. That would be meant for us, but I'm going to show you something that is very important in this section. So part 3, it says, read this section carefully before you start taking Abilify and each time you get a refill. For many of you, this may be your first time hearing this. So now it goes through what the medication is used for, what it does, when it should not be used. It also has a warnings and precautions section where it repeats the black box warning. And look at this. It says, before you or the patient you're caring for use Abilify, talk to your doctor, nurse, or pharmacist. If you have, okay, and it goes through a number of things. It says, if you have never taken Abilify before, have diabetes or high blood sugar or a family history, have ever had blackouts or seizures, have any problems with the way your heart beats, and the list goes on and on. There are about 20 items here that it warns you should talk to your doctor about before you take Abilify. Now, I can guarantee for the majority of patients, this conversation has never been had, and it's saying you should do this before. Now, some people might say, well, there's a warnings and precautions section in the consumer information, so why not just leave it at that? Why mandate that the doctor share the warnings and precautions in the health professional information section? Well, guess what? Even though it says there are a number of things you should disclose to your doctor, it doesn't quite tell you why you need to disclose these things to your doctor. But the warnings and precautions in the health professional information section does tell you why. It's saying that in persons with hyperglycemia, it can cause this. It's saying that in persons with cardiovascular issues, it can cause that. This is crucial information that you deserve to know and you need to know. So the proposal is saying that both warnings and precaution sections need to be discussed. So guys, this is a look at the product Monograph, something which Health Canada recognizes to be a factual and scientific document. So this document is what government authorities recognize. And this bill proposal is advocating that it be mandatory that doctors go through this before the patient consents to taking the drug. This is life and death, guys. People are dying from misuse and misapplication of these drugs. They're taking drugs that perhaps because of pre-existing health conditions or a family history, they should never have been taking. This is important, guys. Please sign this petition.